Disordered Eating and Eating Disorders, an Overview. This is Dr. Michelle Reich from the Counseling Center at Drexel University. Today we're going to have an overview of different clinical eating disorders and eating disordered behavior, as well as some ways to help others struggling with eating disorders. Clinical eating disorders are considered to be severe disturbances in eating behavior. There are preoccupations with food and/or weight and body image. At this time, more than 90% of those diagnosed with a clinical eating disorder are females, but we should note that males are on the rise. The first disorder that we're going to talk about today is anorexia nervosa. This is a potentially fatal disorder characterized by the refusal to maintain even a low to normal weight. Symptoms for anorexia include distortions of body weight and body size, an intense fear of becoming overweight, a refusal to maintain a healthy weight, even a low healthy weight. Among females, they may have sensation of menstruation, and there's also an obsession with food that's irrational and illogical. This last symptom surprises some, thinking that those that struggle with anorexia are afraid to eat and do not think about food. Actually, it's the contrary, and they do obsess at times about food, and they also like to provide food for others. Patients, for the most part, know that they are underweight, but when they look in the mirror, they actually see a distorted vision of themselves and they see fat. They deny that their low weight is an issue, and this can differ by culture to culture. In certain cultures, different body sizes are seen to be normal. Some anorexics also struggle with binge eating and/or purging behavior, and so in addition to the restricting, sometimes these behaviors are present. Clinically, we would call someone who just restricted food intake and had the body image issues anorexia restrictive type, whereas some anorexics that do struggle with the binging and purging behavior would be diagnosed as anorexia binge purge type. The next disorder, bulimia nervosa, is characterized by recurrent episodes of binge eating followed by a way to prevent the weight gain. So there's some sort of compensation for the food that is eaten. Most maintain a close to normal weight, and some may even be overweight. With bulimia nervosa, it is imperative that the person who is struggling with it be checked medically for an electrolyte imbalance and heart irregularities, including irregular heartbeat or abnormalities. When a person struggles with bulimia nervosa, they do feel that they lose control while they're eating. During the binge period, they may zone out. A binge is usually considered an amount of food that is considered large for that person, and it occurs usually over a period of time, with the average about being 2 hours. This happens at least 2 times per week over a period of 3 months for a clinical diagnosis. This person is also self-critical of their body, and there's purging behaviors to compensate. Types of purging behaviors could include self-induced vomiting. This may also be with ipecac syrup or with some sort of object or a finger. Obsessive exercise, laxatives or diuretics, and some also chew and spit out the food. Bulimia nervosa clinically can also be considered a non-purging type, which some also know this as binge eating disorder. For binge eating disorder, it's the same behaviors as bulimia, but without the purging. Usually this person is overweight, they still feel a loss of control while eating, and they eat until they're uncomfortably full. Usually people struggling with binge eating disorder eat alone, due to being embarrassed regarding the food that they are eating, the amount of food that they're eating, and the time that they are eating. Followed by a binge is usually feelings of disgust with oneself and feelings of guilt. If you know somebody that has an eating disorder, or if you feel you yourself struggle with eating disordered behavior, there are certain things to keep in mind. Disordered eating and eating disorders are secretive. This is a type of struggle that most people, when they're struggling with it, do not feel comfortable talking about. There's shame and guilt associated with it. Most likely, the person will get some sort of help because of another concerned person in their life. Please remember that you are not the person's therapist, but you can help them get proper care. So what signs do you look for? For some, weight loss. That does not seem to be due to a medical condition or normal dieting. Exercise that is obsessive in thought. I have to go to the gym, or if I do not go to the gym, and then something bad will happen, or I will be judged, or I will feel guilty. A lot of things can go into that end of that sentence. Exercise that is longer than what is deemed normal. This is a gray area, but it's helpful if you look for specific changes in that person. Someone who is buying medication to induce vomiting and or laxative diuretics without having a medical need for these. And you can also see scars or open wounds on the back of somebody's knuckles, and this is from self-induced vomiting. Almost always going to the bathroom after eating is a concern, as well as swollen facial glands, and this is due to vomiting. The glands are actually under the chin in the back of the neck. You can also look for thinning hair growth. This is hair that develops when the body tries to keep warm when it's in a starvation mode. People who discuss dreaming of food excessively. If you see somebody buying large quantities of food, that is abnormal for them. And also the disappearance of food without being told where it went, and this goes along with the guilt and shame of eating large quantities of food. So what do we do? So now what? One of the things, if someone is talking with you about struggling with some sort of disordered eating behavior, it is helpful to not ever tell the person to just eat. This causes anxiety in the person, and then they will feel like they cannot honestly talk with you. Help this person connect with a professional so that they can eat well and not just more. We're not promoting people just eat more when we try to get them into some sort of professional care. We just want them to become healthy. Realize that this is overall an issue of control, and so it's more helpful to empower the person to feel better about themselves versus shaming them because they have these struggles with food and their body. Talk with the person to encourage a medical checkup. If they are resistant to getting a medical checkup, you can tell them that they can ask the doctor to do blind weights, which means the doctor takes their weight and does not show them what it is. Or you can also encourage the person to go to the doctor to address other symptoms so that they are less defensive. So if the person is complaining of fatigue, irregular heartbeat, lack of a menstrual period, then these are things that you could say, why don't you get that fatigue checked out? And then hopefully they would be able to take the next step and talk about the eating disordered behavior, or they may ask you to go with them. We have some resources for you if you feel that this is something that you would like more information on. You may go to the Drexel University Counseling Center website. The address is presented on the screen. This will give you a variety of resources, not just for eating disorders, but also for other things that you may be struggling with. For the medical piece, you can start at the Drexel University Health Center website. And there's also some other websites. The National Association of Eating Disorders, NEDA, is a website that is very helpful and provides not only information but also resources that you can tap into. And then 2 local eating disorder centers that provide inpatient, outpatient, and group therapy. One is the Renfrew Center, and you can go to their website to find where their center is located as well as what they offer, and also the Belmont Center for Comprehensive Treatment, and this is located at Einstein Hospital, and you can go to their website for more information.